You are listening to the
World Extreme Medicine.
The World Extreme Medicine
Podcast.
In this episode, we're going to be diving into the crucial but often overlooked aspect of post-op care, that of post-mission debriefing in HEMS. What to do really is look at concept of compassionate debriefing with Leif Rognås and Karina Damsgaard. So debriefs are meant to enhance learning, improve performance, and indeed support clinicians' well-being. However, research suggests that traditional honest debriefs may not always serve their original purposes in practice. With flat team hierarchies, complex decision-making, and no clear right or wrong choices in many situations, the current debriefing models may be falling short in practice. So our guest today have introduced a new perspective on debrief, the compassionate debrief, which aims to shift the focus from critique to support, learning, and psychological safety. But how does it work in practice? And the questions we're going to ask today really center around, can a more compassionate approach reduce stress, improve retention, and foster better learning environments? So in this episode, we're going to explore the limitations of traditional debriefing, the impact of negative experiences on clinicians, and how HEMS teams can implement a more effective debrief strategy. So welcome to the podcast, Leif and Karina.
Thank you so much. Thanks for having us.
I wondered if we could, before we kick off with maybe the more formal questions, could I just get you to both maybe speak to your experience? Leif, if I could get you to go first, just maybe a brief introduction to yourself.
Yeah, sure. I started out as an ambulance technician a long time ago, back in 1989, 1990. And then I went to medical school and became a doctor and then an anesthesiologist. So I have a dual qualification as an anaesthetist and an intensive care doctor.
Fantastic.
And then I did a Scandinavian fellowship in emergency critical care and pre-hospital care. And I also got a PhD in pre-hospital airway management. So now I work in a split role where I do about half my time as a consultant anaesthetist at a university hospital and half my time as a clinical lead and head of medical development with the Danish Air Ambulance.
Fantastic. Karina, to yourself.
Yeah, I work in the Danish healthcare sector as a psychologist, primarily in emergency medicine. I also am affiliated with the Danish Helicopter Medical Service, where I have been doing research focusing on mental stresses in this particular population of high performance teams. So I have a background as a psychologist in the Danish military. So working in these high stress environments, that's what I primarily do, and that's where my expertise is. Yeah.
Fantastic. So this article featured as an editorial in SJ Trem recently around the compassionate debrief, and that's really the topic today we want to double click on it and focus on. So I guess my initial question, Leif, and I'll come to you first, is really, could you maybe speak to just the current approach to post-mission debriefs in HEMS and indeed why they are an essential component of a mission?
Yeah, of course. So you're completely right that post-mission or post-job debriefs are considered essential in many HEMS services. Indeed, so much that it is part of a suggested standard set of quality indicators when it comes to evaluating and doing quality insurance in HEMS. And there is a strong culture in many HEMS services for a structured approach to the post-job debriefs. And the focus of these debriefs tend to shift a bit depending on what we are debriefing. So it's a bit different whether you are debriefing a moulage or a simulation that has been done for training purposes or educational purposes, or if you're debriefing a job that is part of a paramedic or a doctor's sign-off period, where you're working with an experienced colleague who are there to make sure that you kind of get shown the ropes and the way things are done in that particular service. And those debriefs are often slightly different to the ones done after a regular standard job, where it's just the crew who has been on that job who sit down, have a cuppa, and in a structured way go through the job that they've just been to. And then there's the difference between services when it comes to whether they primarily work from a SOP-driven perspective, or they tend to be more structured towards delivering tailored care. And that, of course, have an influence on how you conduct your debrief, because if you are in a SOP-driven service, the debrief tends to focus on, did we follow that SOP? And if not, why not? Was that something we did that was wrong, or does the SOP need to change to be better suited for this kind of job in the future? And it has been shown that, especially if you're doing training or kind of supervising new colleagues in their sign-off period, the debriefs are important, especially when it comes to evaluating and improving critical resource management, and how the team work together, how the workflow goes, how we collaborate with the ambulance service, other emergency services on scene. And they are also often thought of as being capable of improving crew well-being, at least if they're done well.
So just looking at the concept of honest debrief, Leif, for a second, it is widely used within high-performing teams. Could I get you to speak to maybe some of the key characteristics of honest debriefing, and maybe how it's traditionally been applied in a HEMS context?
Yeah, so that's a really difficult one, because both you and I are old enough to remember how EMS was kind of like 10 years ago, where the discussion about extrication and the cervical collar hadn't really gotten to where it is now. And if you asked people then, why do you put the cervical collar on? Most people would say it's because it's good. It's just what we do. And nobody really knew where it came from. Nobody knew why we did it. And up until recently, that was just the way thing was. And it's a bit the same with the honest debrief. If you try to Google it or look into any medical databases, I haven't been able to find an origin for the term honest debrief. It pops up every now and then, especially if you read literature describing how high-performance teams work, especially if you're talking about military or tactical teams. And they are supposed to focus on the team's performance rather than individuals' performance, except in the circumstances we mentioned earlier, with if you're debriefing a simulation or a moulage. And what's striking, if you look into a lot of the different scenarios where honest debrief has been described and used, they have one thing in common, and that is that they are used in teams where there is a clear command or authority gradient. So there's one officer, one leader, one facilitator of the moulage, who kind of like are supposed to have the answers, and the rest of the team is often debriefed according to their performance up against a set standard of performance indicators. and they're often, the honest debrief is often described as being able to improve team trust. So if you know that your teammates got your back, it's easier for you to trust yourself because you rely on your teammates to tell you if you're doing anything wrong. And the only thing where I've been able to find that this, albeit soft evidence, but still some kind of evidence that they improve performance, is if your indicator is something that has to do with speed. So if it's about doing a task, say as a tactical team or as a HEMS team, fast, getting scene times down, doing a thoracotomy fast, doing an RSI standardized and fast, then honest debriefs have been found to improve performance, because it's relatively easy for teammates to tell me, when I do X, I need you to do Y, otherwise we're wasting time. So that's where it might be useful. And it has also been shown to maybe enhance system learning. So during this job, we realized that we need this device, or this type of equipment doesn't do the trick for us in these circumstances. Then it's also been shown that having a culture of honest debrief might make those processes easier. There is though a backside of this, and we'll get to that later. But there's a very, very narrow gap from doing that well. I think we've all been in a situation where a colleague comes up to us and says, "Hey mate, can I give you some feedback?" And that's just a different way of saying, "Please let me tell you how you did this wrong." So yeah, but it's a fluffy term, and difficult to really know where it originated from.
Yeah, indeed. And like you said, it's really hard to discern it from the literature, really. It seems to be a concept which has grown over time. Karina, could I come to yourself actually and just look at, so the editorial really highlights, in a way, several limitations of honest debriefing. Could I get you to explain why this approach might not always be ideal in real world healthcare settings?
Well, the term honesty, it implies like a straightforward, clear, right and wrong, fact-based approach. But in reality, and in the real life emergency settings and in HEMS settings, reality is often not black and white. It's more like different shades of gray. So what may work in one setting may not work in another setting. So the focus on what is right and what is wrong might not be sufficient when working in a real life setting where there are many right and wrongs, and where it's up to a discussion of what could be the right thing to do for one person might not be the right person to do for another person. So that's one thing. And also, I think that the focusing on facts, so maybe something in fact is true, but that doesn't mean that it's helpful in a high-stake environment for the person to know that in the debriefing. Because in a high-stake environment, emotions play a crucial role. So if you only focus on facts, so you're missing out on all the human aspects and the fact that it's humans who are at stake, who are making decisions, and it's humans with humans' brains and human bodies, which plays a crucial role in your decision-making process. So if you only focus on what was right and wrong in this setting, so you're missing out on all the human aspects and the fact that human nature plays a crucial role. Yeah. Also, I think that if you focus on what was the right thing to do, or what was the wrong thing to do, there's a real risk that you start focusing on fault finding instead of focusing on what is helpful for the particular individual who has been involved in a particular setting.
Yeah, indeed, and like you said, it's really good to reframe that so it isn't, like you said, it accusatory or fault finding, not at all. So there's almost this psychological safety which we'll get to, where people can actually share in a safe fashion and feel like there's learning occurring.
And could I comment just quickly on that, because that risk of having like a blame culture or a culture where you focus on finding things that could have been done better, it often starts out like being trying to be very helpful and trying to improve everybody, trying to improve team performance, trying to improve how the organization performs. But I've had colleagues from different services coming up to me telling me that they've had operational managers telling them that when you go into a debrief, I expect you to come up with 5 things that could have been done better, and that is one very small step from trying to focus on mistakes and how people could have done things better instead of focusing on what they and the organization need.
Listen, I agree with that, and I think, like you said, when there's almost, like you say, a culture of blame, I think it doesn't lend itself to honest reflection. I think people actually recoil. Leif, could I get you just to speak to? So there is sometimes we hopefully empower people to flatten hierarchies when, especially in dynamic situations. Could I get you to speak to sort of how an absence of clear command structure and maybe authority gradient affects debriefing, or indeed the effectiveness of debriefing, sort of flattening those hierarchies?
Yeah, so this is one of the things that struck us when we started looking at this. So as we briefly touched on before, a lot of things that has been written about debriefs comes from the simulation setting, where there is a facilitator that has defined what the learning objectives are and debriefs the teams accordingly. Or situations where you have an officer that could be in say a military unit that debriefs how his or her team performed, but nobody are in any doubt who's the boss, and the boss lay down the rules for how that debrief is going to be run. That's quite different from most HEMS team, because there are no boss in a HEMS team. So yeah, sure, when we are flying, of course the captain is the boss, and when it comes to medical treatment and triage decisions, the doctor is formally the boss, and when it comes to tactical aspects, scene management, extrication, all that, we rely on our paramedics to be the boss and to lead the scene. So where does that put us when we are back on base after a job? Who is going to be running the debrief? Who lay down the rules? Who decides to say that now we are going to focus on this, or I think we need to speak about that? That's not so clear cut in most HEMS teams, and that kind of flat structure with no clear command gradient might be excellent if we are talking about how we felt during the job, or how do we think our colleagues from the ambulance service perceived us during that job? Did we manage to involve them or whatever? But when it comes to debriefing the performance of individual team members, it often becomes difficult, because who is going to debrief how the pilot was flying? And who is going to debrief how the paramedic chose to do the extrication? And it becomes especially difficult if you're working in a system where we more often than not try to provide tailored care more than being SOP driven, because then it comes down to the three pillars of tailored care. So it's tailored care to the patient, but it's also care tailored to the clinicians providing it, and it's care tailored to the organization that those clinicians are working within. So it fairly quickly became obvious to us that these situations are very different from when you are debriefing a moulage.
Which absolutely makes sense, because like you said, and this rings true across multidisciplinary teams, is there's multiple competencies in these teams: aviation competencies, medical competencies, non-technical skills competencies, technical skill competencies, and you're right, it's how we actually evaluate that as a team. Could I get something you both mentioned earlier, which is fascinating and is extremely true within pre-hospital care and within HEMS environments, is that you mentioned this, the concept of shades of grey, and critical care being shades of grey rather than the clear right or clear wrong decision. Could I get you to, Leif, could I get you to speak to how does this reality change the traditional debriefing model? How does sort of looking at, because you're right, there is no succinct right or wrong answer. So how does that reality affect what is historically a traditional debriefing model?
Yeah, so that's really interesting, and I guess the short answer to that is that we do not know, because nobody has really studied it, and we are just on the brink of starting to look into it. But again, it comes back to that difference between the settings where debriefs have been rather thoroughly described, so doing simulations or moulages, or evaluating whether we followed an SOP or not, versus the situations that most HEMS teams find them in on a daily basis, where it's all about biology, and it's about biology without any clear evidence often. I mean, we can't even agree on whether or not it's a good thing to give adrenaline during a cardiac arrest. So that, to me, tells us where we are at the moment when it comes to hard evidence on what is the best treatment for this patient on this day, on this scene, with this crew, in this organization. And it becomes even worse if we're talking about what's the right triage decision, what was the right tactic to get that patient out of that wreckage, or was it what was the best way of driving the scene. And if we start out our discussions of these very important topics by assuming that there is a right and a wrong, we tend to lose the respect for our teammates. So I think it's really crucial that we when we are doing this, instead of expecting there to be a right and wrong, just accept that this is how we did it under these circumstances, with this patient today as a team, and start from there, and hopefully finding things that went well, things we did that worked, and if there were things that needed or could have been done differently, helping each other to understand why we chose what we did, rather than kind of telling each other whether we did the right thing or the wrong thing. And the thing is, if you go into these debriefs with a mindset of knowing that there is a right or wrong, you risk turning the debriefs into a battleground, especially when you know what kind of people tend to be drawn into HEMS work, because we are all overachievers, we are all alpha male or females, and it's a very competitive environment. Not necessarily once you get into it, but we've all been competitive to get there. And if we think that every job has a right and a wrong solution, then there's a risk of us going into a debrief thinking that we are going to compete about who was right and who was wrong, because it's in our nature to do so.
So let's move on and actually look at the concept of compassionate debriefing. So just as a term and as a concept, could I get you to speak, Leif, I'll come to yourself first, about just how it differs from existing models? What are some of the main features?
Yeah, so it's really important for us to stress that we are not against debriefing, and I think it's really it's not even about what we are debriefing, what is on that checklist for how we are running the debriefs when we get back to base. It's the why we do it and the how we do it that we try to get people to rethink. And so I'm not a psychologist. Yeah, I'm just a HEMS doc. So to me, for me to understand what compassion is about, I found it really useful to read the sentence stating that compassion is an intent. It's the intent to be sensitive towards suffering in oneself and others, and the commitment to try to alleviate and prevent it. And it's a very different way from trying to find rights or wrong in a debrief. So instead of going into the debrief, say with the mindset that I talked about earlier, trying to I want to find 5 things that we could have done better. Instead of doing that, we might go into a debrief and starting out by asking ourselves, how can I be helpful and not hurtful, both towards my teammates, my crewmates, but also towards myself. And also, when we are talking about how this job went, am I giving myself and my crewmates the benefit of the doubt? There's a reason they call it the grace of doubt, because it's so important. Realizing that there is always and always will be doubt, and we should embrace that instead of saying, I'm never in doubt, I always know what to do, because frankly, it's BS. And then finally, asking ourselves, what do I need following this job, and what do my crewmate need? And that might not be being told the truth, even though it is the truth. And also, what does the organization need? Do we need to have a better SOP for this? Do we need to have better kit? Do we need to have better training? So yeah, it's just a different way of framing it.
So Karina, could I get you to just come to you and just really get your thoughts on how you define compassion in the context of trauma care debriefing? Because can be some misunderstanding as to what compassion means within high pressure environments. Could I get you to really define it for us?
Yeah, well, I could just elaborate on what Leif said, because compassion-focused therapy is a psychological approach developed by Paul Gilbert, and it integrates principles from both evolutionary psychology, neuroscience, and cognitive behavioral therapy. So, and the main thing about compassion is that it's actually designed to help people replace their self-criticism with self-compassion in order to reduce the emotional burden of guilt and failure. So for me, what's important to stress is that a crucial part of the compassionate approach is acknowledging that we are humans and we have human brains, we have human bodies, and this body and this brain does not always act in ways that are the most smart ways of acting. Sometimes they act in counterproductive ways, but they do that without my conscious control. And that's so important to understand, because this particularly happens, when our emotions take over and I lose my ability to make clear-cut decisions, to think, to be rational. This often happens in high-stakes situations and emergency situations. And that's why in this setting, it is particularly important to know this, because people working in high emergency settings, they are often, in their primitive brain, they are often activated in their threat system. So they often act on emotions instead of acting on their conscious reflections. So we have to know, when we do a debrief, we have to know that sometimes people act in counterproductive ways, not because they don't know better, but because they are humans with this brain and this body. And we have to acknowledge that. We have to acknowledge that in ourselves and in others, in order to be able to even just to talk about it, not to feel ashamed about it. So a very important thing is that we should not feel ashamed about sometimes acting in counterproductive ways. On the other hand, we need to talk about it. And that's why compassion is so important to bring into these kind of debriefs. So not only focus on, did I do this good or did I do this bad? But also focusing on that, why did I actually do this? Because often I find that people, they feel ashamed. They had higher thoughts of themselves and others. So when they act in ways where they go like, wow, why did I do this? They need to understand that it's not because you're a bad person or you're not good enough. No, it's because you are a person, you're a human being, and you have this kind of brain. You have been activated in your threat system. And when your threat system is activated, you sometimes just act without thinking. And that's okay. That's okay. We need to talk about that, because when we talk about it with each other, we can start to learn from it. I can start to focusing on my automatic reactions when I am in my threat system. So how do I react when I'm under pressure? How do you react when under pressure? And if we help each other by focusing on this in the debrief, we can start working with it instead of blaming each other and instead of looking at what you should have done instead. So for me, this is the most important part of the debrief. And this is how we foster resilience in emergency medicine personnel. We need to know that we are humans with human brains who sometimes act in counterproductive ways. No need to be ashamed about that. We're just humans. Yeah. So that's what I like about the compassion.
Yeah, listen, I agree actually, and to your point, I think sometimes we don't get insight into how our behaviors play out until we're under pressure. It's very difficult unless it's a common facet, and I think it takes a lot of years and a lot of patience and a lot of applied pressure to really understand fundamentally how you as a practitioner act and move under pressure. And like you said, it's giving yourself and others permission for that to maybe not gone as well as possible, but that's okay, because it's a learning environment, and it's a safe environment. Karina, could I get you to speak to just really the key principles that foster psychological safety in a post-mission debrief? So some of the aspects which you would enact to get to psychological safety.
Yeah, I think, as I just said, one of the most important things to foster learning and development is that we need to work with the human nature and not against it. And compassion is focusing on the human nature. So we need to know how we react under pressure, and we need to help ourselves and help others to understand that yes, we do react when we are under pressure. It's normal, it's okay. And for the individual person to know your own reactions when under pressure, that's so crucial, because if you know it, you can do something about it. If you don't know it, you will just be like a puppet in a string, where you are where the puppet master is your own emotions, and you don't even realize how you act when under influence by your own emotions. So starting to looking at your own reactions under pressure, that's so helpful, because when you look at it, you can do something about it. So that's like the main principles in this way of talking about how we react when under pressure, and we can help each other focusing on this.
So just looking at the editorial, Karina, it includes testimonials from clinicians who experience negative debriefs, and sometimes it's actually really powerful to get the voice of clinicians into these pieces, because I think that speaks the loudest. Could I get you to speak to some of the common emotional and psychological impacts of poorly conducted debriefs?
Right. If you don't pay attention to this fact that we are humans, and humans sometimes do stupid things just because we're humans, people often feel like a failure, and they start blaming themselves. They start criticizing themselves. They start criticizing each other, because now I feel insecure. Okay, so when I feel insecure, I start blaming back. So instead of learning, instead of developing, instead of listening to what other people say to me, I start being defensive. I shut down. I instead of taking things in, I start protecting myself. So actually, in fact, instead of learning stuff, you just start to feel like a failure. You start doubting yourself, and the worst thing that can happen is that now you don't even want to share stuff with your colleagues, because you're afraid that if I say this, in a minute they will start criticizing me. So it's better if I don't say. It's better if I just shut down. And then you see, if you shut down, you don't talk about it, you won't make room for all of these human factors that are so important.
Listen, I couldn't agree more, actually, with that. Could I get you to speak to the concept of implementing compassionate debriefing? How do you see it really improving staff well-being, resilience, and retention within HEMS teams?
Yeah, it is possible to train this, because knowing how the brain works, knowing how I react under pressure and stuff, all the stuff I have been talking about, also that's a part of being resilient, and that's how we enhance resilience in people working in emergency settings. That is knowing yourself good enough to know how you react when under pressure. So if you want to implement this, first of all, you have to gain knowledge about simple human reactions when under pressure. So you have to, this you have to know, and then you have to acknowledge it and focus on it and talk about it, like normalize that this is how people work when under pressure. So I think for me, one important thing is, it's quite simple. It's knowing knowing how our brain works and how our body works in psychological terms when under pressure, because it takes some edge off, because people know, okay, it's not just me, everybody else is doing this. Okay, it's not because I'm bad at my job. Hey, it's just my emotions. And that's quite nice knowing that, and to be able to talk about it as something outside of me, not something inside of me, but something like, this is common, people do this, that's okay, let's talk about it. So that's for me the most important thing. If you want to implement this, you need to know this.
No, indeed. Leif, I'm just going to come to yourself actually and just look at integrating compassionate debriefing into existing culture, because something both Karina and yourself, Leif, have mentioned is it fits nicely or counterintuitively within a culture. So the culture really dictates whether there is psychological safety, whether there is more adversarial or accusatory kind of learning. It can't just be about KPIs, like you said before, the shades of gray. It really is about learning together, and although it's a fundamental part of the mission, it can't necessarily just be about hitting these metrics. Could I get you to speak, Leif, to really how you see integration of compassionate debriefing into existing cultures, and maybe indeed what are some of the most significant barriers to change?
Yes, I think it's really important for us to stress that it would be wrong of us to pretend that we have the answers of how this should be done, because it hasn't been studied. Nobody really knows what's an effective way of introducing this into an HEMS service, say. But I think just starting out, knowing that the end target is what Karina described, that we all should know that this is a normal part of how our brains work. But on our way there are some minor steps that we all could do, like tomorrow, and that is by just knowing and remembering that compassion is an intent. Like I said before, it's wanting to be helpful, not hurtful. It's wanting to give my crewmates the benefits of the doubt, and that's a fundamentally different way of thinking. But it's not hard to understand. It just requires us to shift our focus. It's not difficult for us as individuals, and we're guessing that it's not that difficult for organizations as well. And I think if we're talking about barriers, they are presumably some of the same barriers that are known to be in place towards any kind of change, really. So believing that what we are doing is good enough. Why do I need to change? Change is cumbersome, and also the belief that honesty per se is good, and just because it's true, I should say it, and I should say it now, regardless of how it comes across. I think that would be a significant change for a lot of persons and a lot of systems, and also the belief that compassion is fluffy, that it's for softies, that it will make us all weak and sitting in a huddle crying after each mission. And that's not what it's about at all. It's the opposite. It's about making us more resilient. It's about making us more aware of what our difficulties are as human beings and as clinicians.
Yeah, absolutely. No, absolutely. And I think it's far more of a holistic approach than traditional models, actually. But looking ahead, finally, as we come into land on the conversation, Karina, I'll come to you first, and then to you, Leif. Just really, could you to speak to further research or training that you believe is maybe needed just to refine and evaluate the concept of compassionate debriefing?
I think actually that a lot of people are doing this already, and the bottom line is that post-mission debriefs, they are valuable, and they are most valuable if they are done with care. And the fact is actually that we should not overemphasize, the accuracy, the factual accuracy of what we are doing without considering the human aspects. Because if we do that, I think it could lead to unintended consequences. So what we need to do is, to integrate and make sure that debriefing is done with care, and it's done with the best wishes for my colleagues. I want to be helpful because if we succeed in that, I think it's possible to reduce the moral stress and in truth foster learning and foster resilience. So for me, it's not like, I don't think we need to do so much different. This is just what, as Leif just said, I think we are doing so much good already. And even for just the fact that people are doing debriefings already this is good. So I think maybe it's just a small adjustment, just to pay attention to it, to pay attention to the human factors, that we are humans and we act in sometimes unintended ways, and that's okay. We need to talk about that. So I think it's a small change, it's a small switch that we just need to switch on. It's not a big thing, it's just to pay attention to it.
Yeah, finally, Leif, to yourself.
Yeah, I totally agree, and I think again, it's not as much about what we are doing, it's about how we are doing it and why we are doing it. And if we are talking about research and how to move it forward, that's really kind of tricky for doctors and paramedics, because we are mostly trained in counting numbers and doing statistics. But this is, if you want to do this right in a research setting, you need to do it with a qualitative methodology, and to be able to do that, we need help. So I definitely do not have the answers for how we are going to move this forward in a research or quality insurance sort of way in the future, but we will definitely be looking at it and trying to go down that road, because we need to do research, but we are just in the early phase of looking into that.
Listen, I just want to say thank you to you both. It's fantastic just to share this concept, dissect it and unpack it. So thank you to both of you.
Thank you so much for having us.
Thank you. Thank you so much for having us. Yeah.
Thanks for listening to the episode. Please feel free to rate, review and subscribe on whichever platform you're listening to. Please also head over to the World Extreme Medicine website, where you can find more engaging content on extreme medicine webinars and indeed a collection of courses from our global network, including humanitarian, disaster relief, expedition, space, military, tactical and performance medicine. Thanks again.